Sandha J is joining us, Group CFO of Narayana Health. Thank you so much, ma'am, for speaking with us today on NDTV Profit. Pleasure to have you on. Let's just start from getting your perspective on the GST cuts. How do you think this eases the burden for patients, and how are you looking at it as a company in the business?
Good morning. Thank you for having me here. So the GST impact we want to consider in three parts. The first part is the GST on drugs and medical supplies. It has come down from 12% to 5% for most categories, and 36 life-saving drugs have been exempt from tax. So this is a benefit that we will fully pass on to the patient. Our total revenue in this category may be around 600, 700 crores. So the impact of that, the patients will see immediately as soon as this takes effect. So about a 7% reduction impact. On the life-saving drug side, about 50 crores will be the kind of revenue we are earning, and so that category will see the full benefit of the exemption. So this is part A. The part B is on the capital equipment side, mainly medical, surgical devices, diagnostic kits, etc. So these have been brought down to 5%. Our annual investment in this category is about 100 crores odd, but this will be linked to refresh cycles, and of course, this is applicable prospectively. So we typically do a price correction on the 1st of January. Our pricing philosophy is to pass on very little to the customer and be able to manage our price increases through efficiency. So we take low single-digit price increases every year. Whatever benefit we are going to receive from the reduced input taxes on capital equipment, that we will definitely ensure that it gets passed on in the consideration how we are building up our price for the next year. The third part is because we are on a construction phase, and given that we have announced expansion like you just spoke about, so we are still wanting to understand how the reductions that have come in the construction space is going to benefit us. So that will hopefully have some benefit into the cost of the buildup of our new hospitals.
Got it.
So this is the hospital side.
Right.
Sorry.
No, please continue. Please continue, Ms. Sandhya.
On the insurance side, the health insurance premium, we have the reduction in the GST. Currently, our key product is Aditi. It is a missing middle product. And we aim to, it's priced at an average price of about 10,000 for a family of 4. So that's really the price point at which our product operates. And we are hoping that we'll be able to keep the price point at that level, and the GST benefit is passed on. We are still working on the specifics on how to offset the input tax credit loss. There are some clarifications that the industry body has also sought on this, but broadly, this is the impact of the benefit for our sector.
Ms. Sandhya, so the question is this, that because healthcare or medication is not, how do I say, a demand which will go up because prices have come down, right? People will only consume as much, thankfully. People only consume as many medicines as need to be. Does this have an impact on your top line? It may not have impact on volumes and business, right? But does it have an impact on the top line negatively? And therefore, could there be some, in the immediate term, some pullback in the numbers because of the lower price points across categories?
Given that we intend to pass on the entire benefit of the GST to the customers, so to that extent, we will see the impact on the top line. I think I shared the numbers earlier. But I don't think this is a worry about top line. We all are striving to bring the cost of healthcare down, and this is a very positive move. So therefore, we are not, I think we will be able to As part of our organic growth process, we will be able to cover the top line gap. But this is an important step, and we want to celebrate it with that intent.
Completely. And let's come to that organic growth. There is a planned investment of about 3,000 crores. Can you give us some sense and structure of that direction? Of course, a bed capacity increase of 7,600 beds will also take place. Ma'am, what is the breakdown and the timelines that you're seeing? Can you give us any color on this?
But we have announced 6 projects. Most of them are greenfield in nature. Some of the projects are, a couple of them are brownfield in nature. Or no, a couple of them are greenfield, but they are on lease. So some of them are our own, and some of them are where someone is building it to suit for us. Most of these capacities, about 2,000 beds is what we are adding. Most of these capacities are going to go live in FY28, FY29 time frame. So therefore, over the next 2 to 3 years, we are only going to be, at the moment, looking at organic growth in the segment like we have done in the past several years. Having said that, we continue to explore more opportunities, and if there is a meaningful opportunity that comes our way, we will consider it.
Well noted. Ms. Sandhya, it's important for the country to have the cost of healthcare down. So I'm glad that this move has happened, and hopefully it helps all the patients that need it so badly. Thank you so much for taking the time out and being with us today.
Thank you.